Thank you. We're going to go to Mr. McGuire.
Thank you, Mr. Chairman, and thank you to the witnesses for being here today. This hearing is truly bipartisan, as it is in everyone's interest to ensure American citizens, especially our children, are healthy. I have to commend the Trump administration, the MAHA Commission, and of course the Working People's tax cut, the Working Families tax cut, for making efforts to streamline and improve our programs that help kids. The MAHA Commission report released worrisome data about the health of American children. I would like to take the time to highlight some of the top-line items from the report. And first of all, this will tie into everything we're saying here, is I think that we need to relook at health care, not just for adults, but for children, that we should have a preventative health care system. And by bringing back the presidential test and things like that, I think it's preventative. Also, you cannot exercise your way out of bad nutrition, and we have to build a strong foundation at a young age. But we found out that more than 1 in 5 children over 6 years old is obese in America. More than 1 in 4 teens have pre-diabetes, which is preventable. Teenage depression rates nearly doubled from 2009 to 2019. 3 million high school students seriously considered suicide in 2023. You know, during the Depression, when we had a tough time in our country, and in World War II, when people were losing family members, depression rates weren't where they are today, even though we're most educated today and we're wealthier today than ever. Our children are not as healthy as they once were or should be. Dr. Fink, in your opinion, does living in a sedentary lifestyle contribute to the likelihood of a child being included in one of the previous statistics I mentioned?
Yes.
And Dr. Fink, how does a sedentary lifestyle impact mental health?
There are so many factors, but when our children's youth are tied to a screen all day long and they're not being active, they have a buildup of fat in their bodies, right? You're not eating right, you're not active, you have excess body weight. Through excess body weight, you start making extra hormones, and you have all sorts of metabolic impacts that impact every aspect of your body, including the developing brain. And so we most definitely want to make considerations for how we can get our kids active, which is, as you said, bringing back the presidential fitness test and just really challenging families to become active is the way we need to go.
Well, I think you just said it, but President Trump recently signed an executive order that reinstates the presidential fitness test, which was phased out by President Obama in 2013. Dr. Fink, how do you believe the reinstatement of the presidential fitness test will benefit school-aged children?
Well, I'm speaking from someone who did the presidential fitness test as a child. It's really a fun experience to get together with your classmates and do those exercises and challenge yourself to get better each year.
Yeah, you know, it's really an education on how to prepare and take care of your body and mind the rest of your life. And people that work out statistically are less likely to be depressed. Dr. Studi, an estimated 70% of American diets come from ultra-processed sources. What problems can ultra-processed foods cause for children who consume them on a regular basis?
I think it's really around the overconsumption of ultra-processed foods, and there has been research that suggests and kind of tries to look at what are those mechanisms. There has been studies suggesting that consumption of ultra-processed foods have been associated with higher body weight, increased risks of different risk factors associated with disease. There are a number of reasons why that may be. Is it because they're high in added sugars, added fat, added sodium? Is it because they're low in fiber? Is it because they are displacing healthy foods in the diet? I think it's probably many different things. But we do see a relationship between overconsumption and risk, including in childhood.
You know, lack of healthy food is a concern in my district, which is very rural. And I'd ask both of you, how can HHS, how can USDA work together to expand successful community-based nutrition programs in my district? Either one of you.
Actually, I will take this opportunity to just mention that today Secretary Rollins has announced farm-to-school grants for fiscal year 2026 that they will be coming soon, so she's made that announcement. But we think that's a really important way to get locally raised or locally produced foods into child nutrition programs.
Thank you. I yield back.